My name is Brady Gibson, and we're going to be talking about Alzheimer's disease. So, what is Alzheimer's disease? In order to understand Alzheimer's disease, you have to first understand what dementia is. Dementia is a general term for memory loss and other cognitive abilities serious enough to interfere with your ADLs. Alzheimer's disease is the most common cause of dementia, accounting for 60 to 80% of dementia cases. Alzheimer's is not a normal part of aging. The greatest known risk factor is increasing age, with most people with Alzheimer's being 65 and older. But Alzheimer's is not just a disease of old age. Approximately 200,000 Americans under the age of 65 have early onset Alzheimer's. Alzheimer's is the sixth leading cause of death in the United States. On average, a person with this disease can live 4 to 8 years after diagnosis, but can live as long as 20, depending on other factors. Something important to keep in mind is that Alzheimer's isn't just an old age disease. As you can see there on the second bullet point, approximately 200,000 Americans under the age of 65 have been diagnosed with early onset Alzheimer's. So how Alzheimer's affects the brain. In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, toxic changes in the brain destroy this healthy balance. These changes may occur years before the signs of dementia begin. Researchers believe that this process involves two proteins called beta amyloid and tau, which I think that's how you say it, which can become toxic to the brain. So I know this can be kind of confusing with all these big words. But the main thing here is just know that the two proteins that are toxic and attack the brain are beta amyloid and tau. So continuing with how it affects the brain, as abnormal tau accumulates, it eventually forms tangles inside neurons. So these beta amyloids will clump into plaques and they'll slowly build up between the neurons. So as the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. For instance, the vascular system may fail to deliver sufficient blood and nutrients to the brain, and the brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate, and so as these neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision making, and language problems. So as these neurons die throughout the brain, a person with Alzheimer's will gradually lose the ability to think, remember, make decisions, and function independently. You'll see here that Alzheimer's disease is a slow progressing disease. It doesn't start out to the extreme. It starts out slowly and progresses. So that's something to keep in mind. All right, so signs and symptoms of Alzheimer's disease. So what you're going to see primarily is going to be the memory impairment, such as difficulty remembering events, difficulty concentrating, planning, or problem solving, problems finishing daily tasks at home or at work, confusion with location of passage or time, having visual or space difficulties such as not understanding distance in driving, getting lost or misplacing items, language problems such as word finding problems or reduced vocabulary in speech or writing, using poor judgment and decisions, withdrawal from work events or social engagements, changes in mood, such as depression or other behavior and personality changes. So again, this is something that is slowly developing. They may not exhibit all of these at one time. It's something that just kind of progressively gets worse and worse. So, diagnosing Alzheimer's disease. To diagnose Alzheimer's disease, the primary doctor, neurologist, or geriatrician will review the patient's medical history, medication history, and their symptoms. And from there, the doctor will conduct several tests, and that's going to include whether the patient has impaired memory or cognitive skills, whether the patient exhibits changes in personality behaviors, the degree of memory or thinking impairment or changes, how thinking problems affect patients' ADLs, and the cause of the patient's symptoms. And so from there, the doctors can then order additional lab tests, brain imaging tests, or send for memory testing. These tests can provide doctors with useful information for diagnosis, including ruling out other conditions that cause similar symptoms. So again, dementia can, or excuse me, Alzheimer's can mimic dementia, but you'll see with Alzheimer's it's much more progressive and gets a lot worse over time. So to treat Alzheimer's disease, as of now, there is no cure for Alzheimer's disease. But there are some things that can be done to help maintain the patient's quality of life. So the doctor, the family, and the loved ones can work together to make a care plan. So care plans can just include any of the following. So medicines, these may slow down symptoms for a while and make the disease easier to live with. These medicines may not work for everyone or have a big effect, but it's worth a try. Regular doctor visits to check the person's response to medicine. Look for new problems, see how symptoms are changing, and provide continuing ed to the family. So treating other health conditions such as depression or hearing and vision loss, as well as planning how the person can be as independent as possible and manage his or her own life as long as possible. So the outlook for treatment with Alzheimer's disease. So this is kind of looking over some of the treatments and research that's been done. So recently, a new drug to treat Alzheimer's disease, medicine A is what we're going to go with, was researched but ultimately deemed a failure. So medicine A belongs to the class of drugs known as the anti-amyloid monoclonal antibodies. These molecules are manufactured biologically and injected into research subjects with early Alzheimer's disease. And what they do is they basically just target amyloid cells like the way our own antibodies attack infectious bacteria. So in early trials, medicine A appeared to have disease-modifying properties. When administered to people in early stage of Alzheimer's disease, it not only reduced brain amyloid content, it also appeared to delay cognitive decline. Unfortunately, though, after further research and testing, this drug was proven to not show any improvement in treating Alzheimer's disease. But continuing on, Medicine's A apparent lack of success was not the end of its story. Biogen, the people who made it, re-examined the analysis that labeled this drug a failure. So using additional data gathered during the final months of study, Biogen revised its earlier assessment. So in 2020, an application for approval of Medicine A will be submitted to the FDA, seeking permission to make it as an Alzheimer's disease treatment. Medicine A is only one of the estimated 132 Alzheimer's medications currently being tested in 670 trials. The identification of new targets and new drug mechanisms have researchers hopeful of a possible cure in the future. So you can see researchers are hard at work trying to come up with a cure for Alzheimer's disease. So in conclusion, Alzheimer's disease is a nasty disease that destroys every aspect of the victim's life. It strips them of their ability to function, think, or enjoy life. Alzheimer's disease takes the life of over 120,000 Americans every year, making it the 6th leading cause of death in the United States. To date, there's no cure for Alzheimer's disease, and the battle to find a cure for Alzheimer's disease is still ongoing, but hopefully one day a cure can be found for Alzheimer's disease. We'll go here with our sources, and then this last slide here, that's a picture of my great-grandparents that unfortunately both passed away last year. But my great-grandmother, Granny, she battled with Alzheimer's for probably about 10 years before she passed away. So I know firsthand what the disease looks like and how it destroys the person's life. And it's just a very awful disease, a very sad disease to see take somebody's function away. Um, but hopefully, in the years to come, researchers will be able to develop a cure for this disease. Thank you.